The electronic health record. A resilient health system with us, its patients, at its centre. The Irish health system is mostly paper-based. This means that our health records are written on pages, in folders and files, which could be in many locations around the country. Many of us as patients have already experienced the limitations of this system. Waiting lists, difficult communication between departments, filling out form after form, missing appointments, limited access to our own information. Internationally, health systems have transformed by switching to digital records. Now, the HSE, which is delivering eHealth Ireland, is taking the first steps to develop a National Electronic Health Record, EHR, a resilient health system with us, its patients, at its centre. With the digital system, we can say goodbye to many of the restrictions of the old system and welcome a new, modern system that will enable us, the patients and clients of the health service, to have full access to our own personal health information, facilitate collaborative working practices where different health professionals can work together in real time in order to provide each of us with the best care, enable fast access to services which will improve waiting lists and our care, and handle our information using the most advanced data security measures. After all, our health information is personal and private. Introducing EHR to the existing health system seems like a huge task, but already eHealth Ireland is inspired by and continues to learn from other countries' failures and successes, as well as Irish examples like Temple Street Children's Hospital and the Galway Clinic, where clinicians can access patients' records digitally. eHealth Ireland's team is committed to making EHR a success across Ireland.
So, how can connected electronic health information systems improve care for patients, make healthcare workplaces more efficient, and help sustain our healthcare system for years to come? Think about the number of times you've had to recall a patient's history and can't quickly find what you were looking for. Or the number of times you've been waiting for a lab or diagnostic result to make an informed decision about your patient's treatment plan. Or wanted to change a patient's medication, but were without access to pertinent medication information from other healthcare providers. Have you ever wondered if there was a better way for you to capture, use, and manage this exchange of health information among clinicians? Or even if it's possible to have a more complete picture of your patient's health history when or where it's needed? Wouldn't that help you provide the best possible care to your patients? Look at it this way. Say you're caring for a patient who recently had hip replacement surgery, and they come in for a follow-up 2 weeks later. Unfortunately, you haven't received the hospital discharge summary, and the patient can't recall specific tests and treatments performed while in hospital. But they can tell you that the home care nurse practitioner started them on an antibiotic, and the physiotherapist changed their exercise plan. A good start, but not enough information, right? Having access to an up-to-date summary of the patient care, such as their medications, diagnosis, and discharge plan, would have provided you and the patient with the right information to inform the appropriate plan of care. In your community, health information about patients is collected in various points of care, which often don't connect, so information cannot be easily shared between healthcare locations. This means clinicians often have to rely on the memory of their patients or family members who convey their understanding of the diagnosis and treatment plan. Having fully connected electronic health record systems will allow all authorized clinicians to retrieve a patient's health information quickly and securely. Not only will it save healthcare teams time, it will avoid potentially harmful errors and adverse drug events. In order to improve healthcare in Canada, Canada Health Infoway is working with the provinces, territories, and clinicians to create and connect a network of electronic health information systems in your community, province, and eventually across the country, which in the future will allow you to easily and securely share pertinent health information amongst authorized clinicians caring for your patients, which not only improves the efficiency of your professional practice, but contributes to a quality healthcare system in Canada for years to come. And at the end of the day, that gives you the confidence that you will continue to provide the best possible care for your patients.